So my name is Victoria Brown. I'm going to be presenting on health inequity in the U.S., and my project was advised by the lovely Sophie Godley, who has been a very important part of this entire project. Also, my voice might go in the middle of this presentation, which in that case, we're just going to have a dance party. So that's totally okay. Charles agreed to that. So the main point of my project, as you can see here, was just basically spending a lot of time in the library and reading a lot of stuff. So in case you were wondering, there are people in the library in the summer on Sunday nights. Who knew? I know now. So I just did a lot of research, and then I compiled all this research and came up with some key models that I put together to create a new model. And so for the first part, before I really delved into the research, I wanted to figure out very concrete terms for what an inequity is versus a disparity, because these terms are often ambiguous, they're often interchangeable, and I think they're used incorrectly. So for my project, I defined a disparity as a development of a difference in health regardless of social issues, and then an inequity as something that requires a social construct to develop. So an example of a disparity would be something like sickle cell anemia or Tay-Sachs disease. And an example of inequity, which we'll see many of them, would be something like differences in diabetes rates and things like that. So one of the things I found in my research was that a lot of public health researchers use anecdotes or ideas or stories as ways to model these very complex issues. And so the model I developed is a layered system that has, for each layer, there's 4 of them, that has a model and then an anecdote. And then for my presentation, I just chose one inequity to talk about, but for my actual thesis, I had a lot of inequities that I discussed and I applied the model to. So inequities, they're kind of like onions or ogres. They have a lot of layers, so you have to go through each layer in order to get the full picture. So the first layer of my model is the paradigm of health and the river. So the paradigm of health was developed by Bloom, and then the river is developed by a couple of different researchers. There's Braverman and Williams both collaborated to create that model. So for this layer, I looked at occupational health risks among people without documented citizenship. And that's really, occupational health risk is really just a euphemism for things like deep lacerations or loss of a limb, exposure to pesticides, like kind of like poisoning, cancer, things like that. So not like your typical like, oh, carpal tunnel, not that that's good either, but that would be another occupational health risk. But we're really talking about some gruesome things here. So when you're looking at this, you're like, okay, I understand why there's a health disparity. Like they're just completely different fields that you're looking at here, mostly because of the environment that these issues develop in. So here in America, we don't have a ton of legislation protecting these groups because they don't have documented citizenship, which is kind of where this paradigm of health comes in, that first bullet point there. So the interaction between this environment, where there's not a lot of protection, the lifestyle, which puts them at high risk because these workplaces often don't have like safety measures, things like that, and the medical care that they can access, which is not as much because again, they can't really go to the hospital without letting people know that they don't have citizenship and thus being worried about getting exported. So those are all issues that play into this health disparity here. And then you can look at, well, where's this issue developing? Sorry, give me a second. And that's where I apply the model theory, or the river theory. So for the river, there's upstream and downstream effects. And there's a story about a town that's on a river, and they have a lot of pollution in the river. They've created these amazing systems to deal with the pollution, to be able to get people to hospital if there is a poisoning. And you can buy filtration systems, and while not everyone can afford it, everyone has access to them. And then you're sitting there and you're wondering, well, why is no one asking why the river's polluted in the first place? And that would be an upstream effect. Well, the upstream is that there's a factory on the river that's throwing chemicals into the river. So when you apply that to this issue, you'll see that if you look at downstream issues, it would be placing a heavier burden on the people affected by the occupational health risks I mentioned earlier. But if you look at upstream issues, you can talk about, well, how does the government protect people in these areas? What kind of policies do we have in place? Are we talking to the people who actually run these businesses and saying, well, what can we do to protect these people better, instead of placing the burden on the people affected by this health issue? So the second layer uses the social-ecological model, and this slide is actually incorrect, and it's supposed to say Gardner's tale, but the Gardner's tale details out the levels of oppression, so it's around the same thing. So for this one, I used HIV and AIDS transmission and progression among Black men having sex with other men. And so for the social-ecological model, we can separate out the different levels of influence in this issue. So there's the individual level of influence, which would be, what is an individual choice? You know, like, are you using a condom, things like that? Are you getting tested? There's interpersonal, so that would be between like you and your partner, or things like that. There's organizational. So that would be like kind of what access do you have to condoms? Are they free in your neighborhood? Things like that. There's community, and then there's policy levels of influence. And policy would be like, well, what's sex ed and things like that. And then you move into the Gardner's tale, which talks about how we either nurture or kind of put out these problems. And that talks about like, what kind of potting soil are you using? Are you using one kind with one group? Are you using another kind with another group? Or is it more about the way that the flowers are interacting? Are they preferring one color over another, which is really just like a euphemism for racism, or levels of oppression. So that would be internalized, which would be the flowers preferring one color to another. Personally mediated, which would be the flowers against each other. Or institutionalized, which would be the gardener choosing the flowers that they want to plant and that they want to pick. So when we apply this to the health issue mentioned above, sorry, losing my voice. I don't know where that's coming from. So when you apply it to the health issue here, you'll start to see that if you look around, like kind of, where are we dealing with this issue? Are we dealing with it at the individual level? Like, are we just talking about like, oh, well, you're not using condoms, even though that's a rational choice for the people who may be getting AIDS or HIV? If we start looking at, well, what are the policy levels that we don't have like comprehensive sex ed in our schools, which I know another case here talked about earlier. So that would be looking at like outside of just the first level of this issue. And if we go into different levels of the oppression and of racism, talking about internalized, personally mediated, and institutionalized, we start to move into this institutionalized area where we see that it's really the way that these institutions act on people. That's where we're starting to see these disparities develop. And so the third layer is the life course and the web of causation. And so for this layer, I chose postpartum depression among women of lower socioeconomic status living in an urban setting with exposure to intimate partner violence, which is extremely particular, and I'll explain why in a second. And then the two examples, the two models and then frameworks that I used were the life course and the web of causation. So for the life course, we're talking about things that happen not just like right when you develop this issue, but also that happen at the beginning of your life or even before your life started with like your mother, something like that, with your family. And then the web of causation is looking at, well, how do, in like messy public health world where we can talk about correlation until like our eyes bleed, but we can't really talk about causation because you can't really pinpoint exactly what causes something. You can't say, well, that one time that Jimmy ate the lead paint was exactly why later in life he developed this kind of cancer. We can say maybe it's correlated, but we can't say it causes it. So that's where we use the web of causation to kind of draw all these things together. So for postpartum depression, with intimate partner violence, it's very easy to place the blame on the wrong people. You can easily look at this issue like we did with the first issue on the first layer and say, well, it's just because there's intimate partner violence among women in a lower socioeconomic status setting in an urban setting. But then you would be missing issues like, well, if you move out, like, why, let's look at that population as a whole. There's a lot of men who are incarcerated in this population. Therefore, you don't have as many partner options. There's issues with access to health care and access to social aid and things like that can have a huge influence on postpartum depression and also on intimate partner violence. And there's a lot of stigma. There's a lot of, well, I'm a new mother, so I must protect my child, therefore I cannot admit that there might be something going wrong in my family or that I might be getting hurt because then someone might take away my child. So that's an important issue. And then if we're looking at the life course, you can start to see how maybe these issues bleed into other people's lives, like particularly in your family, because postpartum depression is often linked with a child's outcome later in life, so their ability to thrive and their emotional resilience and things like that. So that's where you see the life course kind of develop. So the fourth layer is weathering and finding the spider in the web of causation. So for this layer, I chose maternal morbidity and mortality and the racial differences in this area. So basically for this, we're starting to see the biological effects of the social issues I mentioned in the third layer. So you'll start to see that if you control for education, for access to resources, for everything else, you'll still see worse outcomes among Black mothers than you did among white mothers. And that has a lot to do with the way that racism and these issues wear on your body over time. Your body is less able to deal with a traumatic event like pregnancy, like birth, or like a cesarean section than if you hadn't been dealing with these issues for your entire life, and particularly at a vulnerable period like pregnancy. So this asks the question then, where is the spider, or what is the spider in the web of causation? Who is the gardener? And why is that factory on that specific river, like I mentioned before with all of those examples? And the answer has a lot to do with institutionalized systems of oppression, particularly racism. So from all of these ideas, I was able to draw out some key steps that I think that we should take when we look at health disparity, and to say, like, okay, what can we do now? So the first thing is actually something that everyone can do. So it's kind of like, getting your flu shot, using a condom, things like that. They're just really great things to do. It's changing language and changing narratives and not allowing what you're hearing to be okay. So the first thing is, often in public health, we say the risk for diabetes is being Black, or the risk for postpartum depression is experiencing intimate partner violence. The risk isn't actually being those things. The risk is living in America, because you won't see those issues outside of America, or at least not to the same extent. Or you could even say living in Boston, things like that. So you need to kind of change the way that you're talking about these issues and look at who you're placing the blame on. The next thing is changing the narratives. So narratives are these ideas that we kind of recycle and use a lot in our everyday life, and particularly in the media. So one of them would be like a real woman, like real women wear orange, real women wear red, real women have curves, things like that. And the whole point is that a real woman is a person who identifies as a woman, and that is it. So basically just standing up and saying, like, there is no descriptive factor after that. It's just someone who identifies as a woman. Another narrative that we've seen a lot in the past not even couple weeks, like past couple months, is the good kid narrative. And we saw it play out a lot in this situation with Michael Brown and Martise Johnson. Martise Johnson was a UVA student who was brutally attacked by the police, and people argued, well, he was a good kid. He was in the honor society. He didn't deserve this. But the same thing applies for Michael Brown. He didn't deserve the treatment he got, but people kept saying, well, he stole these things and all of that stuff. The point is that they just didn't deserve the treatment that they got, and we need to say it's not okay to talk about them like this. So I'm actually going to move on because I have 0 time. But there are some great programs. I moved past that slide really, really quickly. But we need to kind of support these programs. And then the last thing is learning to be the microphone instead of the voice. So learning when it's important to voice your own opinions and when it's important to just, like, to take other people's opinions and say them instead, because that's what's important about privilege, as you can see from this quote. So I'm out of time, but thank you.